My name's Katie Barker. I'm one of the consultants working within the Trust, and today I'm going to talk to you about postnatal follow-up and discussion about future pregnancies. Now, once you've been discharged from the hospital, as I mentioned to you in one of the previous videos, we do an internal review, and this is called the Perinatal Mortality Review Tool. And once we've got all your investigations back, we organise a meeting with you to discuss the results of both. Now, this is usually about 3 to 6 months after you've been in for the birth of your baby. And the reason for this is that it often takes this long for us to get the post-mortem results back. If you've opted not to have the post-mortem, then sometimes this meeting can be organised earlier. We will try and be proactive in organising these appointments, but if you feel that things are taking too long, then please contact your named person within the maternity team, and they'll be able to chase this up for you. When we organise a meeting with you, this can either be by phone, which is usually the standard that we use at the moment. However, if you had a preference to meeting in person, we can also organise this. Some people prefer not to meet at all and would just like their reports and information as a letter, and again, this isn't a problem, and we can organise for this to be done for you. If you then wish to have contact with us after you've had the letter, then we can also organise a subsequent appointment. During the meeting, as well as discussing all the investigation results, we'll discuss the Perinatal Mortality Review Tool, and as per my previous video, this will involve outcomes from the meeting, which involve the standards of care, any actions that we've put in place following this review, and we'll also answer the questions that you've asked us. Once we've gone through the report and the investigations with you, then what we tend to do is to go through discussions about what you might want to do about future pregnancies, and this would be how you go about doing it and when to try for another baby. Now, one question that a lot of people ask is, when can I try again? And to be honest, there's no right time. From a physical point of view, there's no reason why you couldn't try again after you've had your first period, if you'd had a vaginal delivery. However, from a psychological point of view or an emotional point of view, it's sometimes better to wait a little bit longer. But there's no set time for one person, for each person. It's just an individual decision that you have to make. For some people, we recommend that we do some specific blood tests, and these are usually done about 12 weeks after the birth, but the consultant who sees you for your debrief will discuss if this is necessary for you. Another thing that we sometimes discuss with you at the meeting is whether there's anything that you personally can do to reduce the risk of having another stillbirth or neonatal death, and this can include things like stopping smoking, reducing your weight, managing your diabetes to get the control as best as it can, and also dietary advice, and we can signpost you to support for these different topics. We'll also ensure that you've got the appropriate psychology input, and if you haven't already been seen by our health psychology team, then we can refer you at this point. We also have the excellent services of the SANS and the Teardrop charities as well, which we can get you in touch with. As well as mum having support from the psychology and GP team, we like to ensure that partners are also offered this as well, and our psychologists commonly see the fathers as well as the mothers after deliveries. The last thing that we normally discuss with you is plans for future pregnancies, and this is very individualised based on the investigation results that we have, and also about the kind of situation around the loss of your baby. We sometimes recommend that you have further blood tests, or we recommend that there's additional tests that are needed depending on what has been organised so far, and depends on what the results of what we have already. As I mentioned earlier, sometimes we do a blood test after 12 weeks, and this is a specific blood test called a Thrombophilia Screen, and this is looking at the stickiness of your blood. But the consultant that sees you on the day will be able to discuss whether this is needed with you.